Good afternoon. My name is Alicia McCannon. I chose Alzheimer's disease as my topic this week. The reason why I chose Alzheimer's disease this week is because this month of June is Alzheimer's and Brain Awareness Month. Our patients that we work with every day, we're going through a lot of we call AWVs, AWVs, annual wellness visits. Medicare actually sets this up for the patients, and they come in yearly. We do many mental status exams and do their overall check, their blood checks, and everything else too, just to see how the patient's doing. Sometimes the mental exam is not something that the patient necessarily wants, but of course family members and their friends sometimes are encouraging them to have this done. So the biggest thing to remember, according to the Alzheimer's Association, is the most common symptom is that new memory information that they're forgetting. So it states that this begins in the learning center of the brain. As dementia worsens, it'll continue to progress. And some people become combative or very aggressive with themselves and with others, which can be just family members, friends, and or caregivers at the time. Also, different things that happen are they just get generally overly confused about just events, time, date. They want to know who they can see. They want to be able to be with that person that they still remember. So it becomes detrimental to a lot of these patients and their families, of course, too, because they're needing to relive. Unfortunately, some things, a father or mother had passed, or an aunt or uncle they may be remembering. So this can be harmful or hurtful anyway to these patients' families. There are coping mechanisms, and we can go through that too. But quickly, I wanted to go through the mental status exam that we actually do at our practice. I enjoy it. So there's a couple things that we look for. We start out with a simple thing. Okay, I want you to remember these three objects. At the end of this speech, can you still remember them? It's pen, pencil, and tree. Pen, pencil, and tree, okay? Now, another one would be, I'm going to point to an object, and I want you to tell me what it is. And so you would point to it, and they would say pencil. Another object, a lot of times, is we'll point to a watch. We usually don't try to use a digital watch. Fortunately, that's all I have. But we do try to use the regular analog, and that's what they're used to. And then other things that we'll ask them to do as well is we'll get them to draw a clock. So just a simple drawing. We'll get them to draw a clock, and on the clock sometimes we'll get them to write, okay, I want you to demonstrate 3 o'clock for me. So they'll draw the little small hand at 3 and the long hand at 12. We might pick different times or different things. So, and it's just being able to see with their hand-eye coordination and just their memory of the numbers and stuff as well. Other things that you'll ask them to do are repeat after me. No ifs, ands, or buts. And they'll repeat after you. No ifs, ands, or buts. So, a lot of patients, they'll come out and we try to make it fun for them. So even though it's something that we use to be able to help our patients to see where their mental status is, because there is a scoring of 20 is great. A 30 is what the best is. Of course, 0 is the worst. So the higher the score, the better. The lower the score, the worst. Other things we want to look at are different treatments. There are treatments such as medications that can be able to help slow the process, but you do need to remember that Alzheimer's cannot be cured. So it's just a slowing of this process. Always remember to be calm and be very simple with the patient or person that you're working with. Calm and simple. I hope that you truly learn some information through here. I'll go ahead and put it on the site as well, on my link as well. That way you can have that. And I hope y'all have a great night. Goodbye.